Cardiomegaly, tests and diagnosis. If you have symptoms of a heart problem, your doctor will perform a physical exam and order tests to determine if your heart is enlarged and to find the cause of your condition. These tests may include chest X-ray. X-ray images help your doctor see the condition of your lungs and heart. If your heart is enlarged on an X-ray, other tests will usually be needed to find the cause. Electrocardiogram. This test records the electrical activity of your heart through electrodes attached to your skin. Impulses are recorded as waves and displayed on a monitor or printed on paper. This test helps your doctor diagnose heart rhythm problems and damage to your heart from a heart attack. Echocardiogram. This test for diagnosing and monitoring an enlarged heart uses sound waves to produce a video image of your heart. With this test, the 4 chambers of the heart can be evaluated. Your doctor can use the results to see how efficiently your heart is pumping. Determine which chambers of your heart are enlarged. Look for evidence of previous heart attacks and determine if you have congenital heart disease. Stress test. A stress test, also called an exercise stress test, provides information about how well your heart works during physical activity. An exercise stress test usually involves walking on a treadmill or riding a stationary bike while your heart rhythm. Blood pressure and breathing are monitored. Cardiac computerized tomography, CT, or magnetic resonance imaging, MRI. In a cardiac CT scan, you lie on a table inside a donut-shaped machine called a gantry. An X-ray tube inside the machine rotates around your body and collects images of your heart and chest. In a cardiac MRI, you lie on a table inside a long tube-like machine that uses a magnetic field and radio waves to produce signals that create images of your heart. Blood tests. Your doctor may order blood tests to check the levels of certain substances in your blood that may point to a heart problem. Blood tests can also help your doctor rule out other conditions that may cause your symptoms. Cardiac catheterization and biopsy. In this procedure, a thin tube, catheter, is inserted in your groin and threaded through your blood vessels to your heart, where a small sample biopsy of your heart, if indicated, can be extracted for laboratory analysis. Pressure within the chambers of your heart can be measured to see how forcefully blood pumps through your heart. Pictures of the arteries of the heart can be taken during the procedure, coronary angiogram, to ensure that you don't have a blockage. Treatments and drugs. Treatments for an enlarged heart focus on correcting the cause. Medications. If cardiomyopathy or another type of heart condition is to blame for your enlarged heart, your doctor may recommend medications. These may include diuretics to lower the amount of sodium and water in your body, which can help lower the pressure in your arteries and heart. Angiotensin-converting enzyme, ACE, inhibitors to lower your blood pressure and improve your heart's pumping capability. Angiotensin receptor blockers, ARBs, to provide the benefits of ACE inhibitors for those who can't take ACE inhibitors. Beta blockers to lower blood pressure and improve heart function. Digoxin to help improve the pumping function of your heart and lessen the need for hospitalization for heart failure. Anticoagulants to reduce the risk of blood clots that could cause a heart attack or stroke. Antiarrhythmics to keep your heart beating with a normal rhythm. Medical procedures and surgeries. If medications aren't enough to treat your enlarged heart, medical procedures or surgery may be necessary. Medical devices to regulate your heartbeat. For a certain type of enlarged heart, dilated cardiomyopathy, a pacemaker that coordinates the contractions between the left and right ventricle may be necessary. In people who may be at risk of serious arrhythmias, drug therapy or an implantable cardioverter defibrillator, ICD, may be an option. ICDs are small devices, about the size of a pager, implanted in your chest to continuously monitor your heart rhythm and deliver electrical shocks. When needed to control abnormal, rapid heartbeats, the devices can also work as pacemakers. If the main cause of your enlarged heart is atrial fibrillation, then you may need procedures to return your heart to regular rhythm or to keep your heart from beating too quickly. Heart valve surgery. If your enlarged heart is caused by a problem with one of your heart valves, you may have surgery to remove the valve and replace it with either an artificial valve or a tissue valve from a pig, cow, or deceased human donor. If blood leaks backward through your valve regurgitation, the leaky valve may be surgically repaired or replaced. Coronary bypass surgery. If your enlarged heart is related to coronary artery disease, your doctor may recommend coronary artery bypass surgery. Left ventricular assist device, LVAD. If you have heart failure, You may need this implantable mechanical pump to help your weakened heart pump. You may have an LVAD implanted while you wait for a heart transplant, or, if you're not a heart transplant candidate, as a long-term treatment for heart failure. Heart transplant. If medications can't control your symptoms, a heart transplant may be a final option. Because of the shortage of donor hearts, even people who are critically ill may have a long wait before having a heart transplant. Lifestyle and home remedies. Tell your doctor if you have a family history of conditions that can cause an enlarged heart, such as cardiomyopathy. If cardiomyopathy or other heart conditions are diagnosed early, treatments may prevent the disease from worsening. Controlling risk factors for coronary artery disease, tobacco use, high blood pressure, high cholesterol, and diabetes. Helps to reduce your risk of an enlarged heart and heart failure by reducing your risk of heart attack. You can help reduce your chance of developing heart failure by eating a healthy diet and not abusing alcohol or cocaine. Controlling high blood pressure with diet, exercise, and possibly medications also prevents many people who have an enlarged heart from developing heart failure. Stay ahead of the curve with the latest medical breakthroughs and expert analysis. Subscribe to MediDoc Video now and take control of your health.